Well, good afternoon, everyone. Welcome to the third edition of the Bedrocan webinar series, a 30-minute lunch webinar, this time with a special guest, Dr. Monique van Velzen. Welcome. To start off with some house rules, if you have any questions for Monique or for me or for anyone, please use the Q&A area. You can find, if you move your mouse, you can see Q&A in the bottom. And if I will be looking at the questions and we'll use them throughout the webinar. Today, we're going to talk about chronic pain, medicinal cannabis and opiates with Monique. But to start off, first, we'd like to know how familiar are you with the topic? So a poll will appear. Could you please click on the answer that applies to you? So a poll will now appear. How would you describe your knowledge about the effect of medicinal cannabis on pain relief? Would you say you're an absolute expert, or about average, below average, or are you new to the topic? So let's see the knowledge level of our participants. Okay, it's about average, and we have no experts. So Monique, there's still probably, hopefully after this session, we'll have a little bit more experts, but it's nice. So people know about the effects of pain relief, but not exactly what it does. That's what I see. And just to get a glimpse of who you are, what is your connection to medicinal cannabis? Are you a healthcare professional? Do you work for the government? Are you a researcher? Are you in the business somehow? Are you a patient or something else? So let's see the results. Nicely divided. We don't have any government representatives today. About half is from business. We have some healthcare professionals, researchers, a patient, and someone else. I'm keen to know what the other is. Maybe you can put it on the Q&A later on to see if we missed the category. But this gives us an impression. Thank you very much. As I said, Monique, welcome. You're an assistant professor at the Leiden University Medical Center, and your area of focus is chronic pain, and whether or not in combination with lifestyle factors. And since 2017, if I'm correct, you're involved, or a little bit earlier already, in research with medicinal cannabis and chronic pain. And you are since recently, a board member of the Dutch Institute for Medicinal Cannabis, and you focus on the research coordination of the Institute. Well, very happy to have you here today. Before we dive into the topic, can you please tell us a little bit about yourself and chronic pain? What is chronic pain?
Thank you, Ola. Thank you for the invitation and the kind introduction. I'm very happy to talk about my research interest here. You're correct that I worked at Leiden University Medical Center. I am a biomedical scientist. And after my PhD in quite fundamental virus research, I decided to switch to a more directly clinically relevant topic, which is the topic of chronic pain. I'm guessing that most of you will know someone with chronic pain that deals with chronic pain, or maybe you're that someone yourself. Estimation found a couple of years ago that almost 1 in 5 adults in the Netherlands suffer from chronic pain. So approximately 20% of adults has chronic pain. So what is actually this disease when we talk about chronic pain? What is good to know is that we distinguish acute from chronic pain. So acute pain is a sudden pain. For example, if you break your leg, you are in pain. Whereas the definition of chronic pain is when your pain will last for more than 3 months. This means that for more than 3 months, you are living for the majority of the week in pain. And this could be due to an underlying disease that you have, like a musculoskeletal disease, like some bone degeneration, or some chronic, repetitive strain injury, for example. It could be related to rheumatoid disease. Actually, a lot of diseases have pain as a symptom. But since a couple of years, we know that actually when you're talking about chronic pain, the pain becomes a disease on its own. So this means that apart from let's say, the rheumatoid process that is going on in your joints, your pain experience is also changing, to the result that you are in constant pain for a majority of the time. So this, you may understand that this will heavily impact these patients' lives, like working, social things, sleeping. Patients are often depressed. Yeah, this is why we view chronic pain now as an entity on its own, okay, which has a pretty high burden, so to say.
I can imagine 20% of adults, at least in the Netherlands, have chronic pain. So the group is enormous, actually.
Yeah, so this is partly related to the aging of the population, and it is related, of course, to the fact that a lot of diseases have, like chronic diseases, have pain as a symptom. Mm-hmm. So you talk about nerve damage, talk about so neuropathic pain, we call it, and it could be actually where joints are touching each other when you have damage there. So yeah, pain is quite highly prevalent, I would say.
And since a couple of years, you're researching medicinal cannabis for this chronic pain, and your first research was published in 2018, I believe. Yeah, can you share what was the research about, and why did you use medicinal cannabis for these patients?
Yeah, so when you talk about chronic pain, you're talking about most of the times a very long-lasting disease. So you could imagine that maybe if you have a headache, you take a paracetamol and you get rid of your headache. When you talk about chronic pain, you're looking for a treatment that that you can use for a longer period of time as a patient. So there are different things to think about when you're talking about chronic treatment as well. And this is, of course, related to the effect, so the pain-killing effect of the treatment that you're receiving, but it is also highly related to the side effects. And we know that a lot of the treatments that chronic pain patients are using are either not so efficacious, so they lack significant pain relief, or they come with significant side effects, resulting in that patients are stopping their treatment just because of the side effects. So examples of those treatments are anti-epileptics, anticonvulsives, and opioids. And we know that for roughly all of those treatments, long-term effects, the risks outweigh the benefits. So this is when we came into medicinal cannabis, of course, also knowing that a lot of chronic pain patients are already using non-medicinal cannabis to have some relief of their symptoms, some pain relief, and maybe also some better sleep. So we were aware of those field studies, so to say, to know that there should be something in there. And of course, we don't want to research coffee shop cannabis. So this is why we moved to researching medicinal cannabis as a separate pharmacological treatment in addition to the drugs that are available. So this was actually this led us to our first medicinal cannabis research.
And can you share a little bit about what was the research about? What patients were enrolled in the research?
Yeah, so as we found out just a couple of minutes ago, there are a lot of chronic pain patients, and all of them have a different disease that underlies their pain. And we decided to select a population of chronic pain patients that is relatively difficult to treat, and we chose fibromyalgia patients. And fibromyalgia is a kind of rheumatoid disease where patients have widespread pain throughout their whole body. Some of them, so these patients have difficulties finding appropriate treatment regimens. So this is why we chose this population, also knowing that they have some pain processing difficulties, so they're oversensitive to certain pain stimuli. And we have decided to first thoroughly characterize these patients, so understanding like what is wrong with them, what are their symptoms. And then we set up a therapeutic trial, so a treatment trial as a sort of proof of concept. So we tried to just demonstrate that medicinal cannabis could be something for those patients. So we did this in our lab, in our laboratory setting, and we administered a single dose of medicinal cannabis. And we did this four times with 4 different varieties, trying to find idea or hints, or just trying to establish if some of these varieties could cause pain relief in these fibromyalgia patients.
Okay, and how do you measure the effect on the pain?
So yeah, this is actually a really interesting dilemma that we have in pain research. Pain is an emotion, so to say. It's a subjective feeling that can differ whether you're sleepy or awake, if you're happy due to other reasons. So it can be influenced by a lot of different factors. And we know that chronic pain patients, they report to be in pain. So they usually do this by giving a number to their pain. So they grade their pain, they rate it on a scale from 0 to 10, 0 being no pain, 10 being the worst pain imaginable. And this is frequently done in pain research, that you just give a certain drug and you ask for this number to ask if their own pain feeling, if this is declining or decreasing as a result of this drug treatment. So this is of course very valid because it reflects the personal experience of these patients, but you could also easily imagine that it's highly susceptible to suggestion or to the setting or to the day. So this is why we as pain researchers are looking for more objective ways of measuring pain or pain experience. And we do this by, in the lab, we give experimental pain stimuli. So we give, for example, a pressure pain or an electrical pain, like a fixed amount. And we measure the experience of this stimulus at several time points after giving the medicinal cannabis in this case. And as such, the patient will not really know what is the right answer. It will just report what he or she is feeling. And it is generally accepted that this more objective way of assessing pain relieving effect of an intervention. So this is what we used in our trial.
Okay, so you gave fibromyalgia patients, you gave them pain, and you gave them 4 different varieties or sorts of medicinal cannabis and through inhalation, I believe.
Yeah.
What were the results?
Yeah, so they inhaled the vapor, and we used 4 different varieties, as you've mentioned. So some of them were rich in THC, some of them were rich in CBD, some had a little bit of both, and we even had a placebo administration. So this was a medicinal cannabis without the active ingredients THC and CBD. And we gave it in what we call the double-blind fashion. So this means that neither the patient nor the researcher that takes all these tests is aware of which variety is given on which occasion. And by doing so, we also avoid like suggestive effects or expectations from both sides. We closely monitored, of course, the patients for any adverse or side effects. We asked for psychedelic, like how do you experience the drug administration? And a little bit as expected, we saw the highest effects with varieties that contained the highest percentage of THC. So those were the Bedrocan variety and the Bediol variety. But we also saw effects after giving placebo. So this is also what we know from drug trials in pain research, that you have a large placebo effect. And we also saw that the THC-rich varieties also gave the most side effects. So patients were feeling high, and they like the typical effects that you experience with a single dose administration in relatively cannabis-naive patients. So from this first trial, we concluded that probably this patient population has the best effects when giving a Bedrocan or Bediol variety, especially when we look at a little bit more long-term effects. We measured over hours, so we gave it single administration. So the main conclusion was that these types of medicinal cannabis are most likely to be successful for fibromyalgia patients.
Okay. But of course, it's chronic pain, and you only measured a couple of hours. So after this study, you started a second larger study for a longer period, and that one is running right now. Am I correct?
Exactly. Yeah. So indeed, you're correct. Like for chronic pain patients, we need chronic treatment. So after this first proof of concept study, we proved that it could work, and we designed a second study in fibromyalgia patients, where we are now treating patients for 6 weeks. With the Bediol variety. So we selected the variety that appeared to be most efficacious in our first study. So the Bediol variety has quite some THC, but also quite some CBD in there. And we saw that this variety with the combination, we chose that one for our second trial. And our second trial that is currently running is really focused on the side effects. So if we give patients 6-week treatment at home, is it tolerated by patients? Do they experience side effects? Does it fit their lives? Can they deal with using such product on a 6-week basis? And we compare it to the use of oxycodone, which is an opioid, for which we know that it is a pain reliever. So it's an analgesic, it's an efficacious painkiller. But we also know that it comes with side effects, and long-term treatment is not that ideal for opioids. It's not recommended, I would say. And then we have a combinatory group where we give a little bit of both to see if we can limit side effects, and by combining different pharmacological treatments, giving like a best cocktail of pain relief for these patients.
So the research is ongoing right now, so you cannot tell us the results, but are there some intermediate results you already experienced?
Yeah, so we're now approximately, I would say, halfway. So we don't have all the final results yet. I do have like some personal impressions of what we see, what these patients report. So one of the things we see is that patients that are using opioids, they report the typical side effects of headaches, of nausea. Some patients even don't like it because they are a little bit reluctant to use opioids for 6 weeks, although we give a really low dose. And we see in general that the therapy it's pretty well accepted, except for the fact that we see that some of our patients are a little bit hesitant in using this medicinal cannabis in like social situations. So patients can take the amount of medicinal cannabis that they need, up to a certain maximum, of course. And sometimes this means that patients plan to use this medicinal cannabis when they have a family in their homes, or maybe sometimes at work. And the most important thing that we now get from this trial is that some of these patients are having difficulties with vaporizing the cannabis. You have to smell a little bit, maybe in your house, or they feel a little bit uncomfortable. Although we do see that patients are generally having some effect, we do now experience that this could influence the success of medicinal cannabis use for a longer term.
So you're actually not only researching the medical side effects, but determining the social side effects of cannabis.
Yes, so our study is designed to look at side effects, so the unwanted effects of a treatment. And we initially didn't really look at social factors or like factors important for use. And so side effects is one aspect of it, but we now get results back that these patients sometimes stop treatment just because they don't want to use it at work, for example. So this will impact a little bit the design of our study and maybe our outcome. But it's an important thing to realize when you're looking at such a treatment for longer term, and when you're looking at a treatment that should be acceptable for this patient's lives. And sometimes they're just working, they're not just sitting on the couch with their pain. Being in pain, they're sometimes really active despite their condition. So this is something we should be aware of, I think.
So that's also very important to see what's the administration method of the medicinal cannabis, because that really depends. Also a social factor. Yeah,
exactly. And of course we know that the cannabis should be heated, so there's always some sort of vapor, or there's some sort of way you have to administer the active substances. So I think it requires some more research and some more product development, knowing what is the best way for these types of chronic treatments.
Yeah, absolutely. And when you're halfway now, when do you expect to publish the first results of the study?
Yeah, so we hope to finish the trial like beginning of next year, a little bit depending, of course, on the COVID delay, but and then we hope to publish like in a couple of months thereafter. So I would say stay tuned for our publication, but we will keep you informed. I
think Bedrocan will as well.
You will know, yeah.
Yeah, looking forward. And And as a third one, last year, you were part of a research group together with the Center for Human Drug Research in the Netherlands. And you received actually a 1.9 million grant from the Dutch Ministry of Health to research medicinal cannabis in neuropathic pain. How's that going?
Yeah, so we are really happy. Like, we are more chronic pain interest, knowing that there's a large burden of chronic pain to society and to these patients. And we're of course really happy that the LUMC or WHO was able to support us financially by giving us a grant investigating the place for medicinal cannabis in this case for neuropathic pain patients. So there are a specific type of chronic pain patients. And with this grant, we will perform several studies looking at the most optimal ratio of THC and CBD for pain relief, and of course also for side effects. And then we will characterize chronic pain patients. So we will exactly measure how their brains are processing pain, what kind of abnormalities they have, to see if we can come up with a sort of targeted therapy, so that we can say you have this kind of disease or this kind of subtype of disease, and you will probably benefit most from this combination of THC and CBD, to see if we can really find an indication for a specific treatment for a specific patient population.
Okay, and that research will probably not be done by inhalation, right?
No, so we will probably look for some other formulation to see if we can also standardize the route of administration. And I have to say, like, these studies will take a couple of years to be, so they're quite large studies. So we have to be a little bit patient before we have these results.
Yeah. And yeah, you've been researching medicinal cannabis and pain for several years now, and you'll be going for a couple of years also. What is your end goal? What is your dream or your ambition in this area?
Yeah, so one of the things I really believe in is that we should really understand the abnormalities that these patients have. So when we talk about chronic pain, it's like a big bucket of a lot of different types of patients, with a lot of different underlying diseases, a lot of different lives, like activity patterns, age. So I think efficacious therapy starts with understanding the abnormalities in your patient. So I think we should really investigate in understanding the different types or the different subtypes that are present in chronic pain. For example, for diabetes, we know that you have a type 1 and a type 2. And if you, for example, take fibromyalgia, we know that there are a lot of different types of fibromyalgia patients, and we don't actually know if their needs in terms of treatment are different. So I think it starts there by understanding what are the abnormalities in patients, knowing how to fit your therapy to these types of abnormalities. And when we talk about abnormalities in pain, we frequently talk about nerves. They of course transmit the information to your brain, and your brain is processing these signals to the pain experience. And this can be oversensitized, or it can be abnormal, or so this is what we should understand in order to know how to treat it.
And do you think that is cannabis only used to suppress the pain? And what happens when you stop? Because can you actually, would it be possible to stop it on the long term as well? Or is it actually suppressing the symptom?
Yeah, so of course it would be intuitive to think like we give a painkiller and then you just stop the signal. When you stop the treatment, your pain will come back. But what we actually know in chronic pain is that a lot of systems that process pain are abnormally shaped, so to say. So it's like when something derails, it derails for a longer period of time. And what we believe is if you give efficacious treatment, you could also train your brain to react in a more normal fashion to, for example, incoming pain signals, or to behave more like a normal brain, I would say. So I don't know if we can say that we can cure the pain, but I do think we can train the brain to process pain signals in a more healthy fashion. And I think we can do that with therapeutics, so the pharmaceutical treatments. Although I don't know if medicinal cannabis would be the answer. I think there are ways to train your brain, maybe in combination with cognitive therapy or with behavioral therapy, knowing that that you can shape your brain to process pain signals in a more normal way.
Okay. And your first research was pretty groundbreaking, I'd say. You got a lot of attention. How did I get a question in the Q&A session? How did doctors respond? Do you see what was their response? Are they now eager to prescribe?
Yeah, so this is a great question, especially because we saw our study as a sort of proof of concept, like a basic study where our first attempt to really demonstrate a medicinal cannabis variety in a chronic pain population. What we know is that a lot of prescribing physicians, a lot of doctors are relatively unaware of the indication for medicinal cannabis, maybe apart from oncological pain or the oncological palliative setting. For other types of chronic non-cancer pain, I think physicians are in general relatively reluctant to prescribe medicinal cannabis because they're so unaware of the effect and the indication. When I talk about prescribing physicians, I talk about pain specialists because it's a relatively young specialism, but those physicians are able to really understand like which pain treatment is efficacious for which patient population. So we didn't see yet that all fibromyalgia patients got Bedial prescribed, but I think this is sort of a change management that requires some time. And of course, more evidence that long-term treatment is also a good option for these patients.
And as a follow-up question, I can't see who asked it because it's anonymous attendee, but I think it's the same person. He or she asked, are pain clinics that are specialized in medicinal cannabis, would they be a good alternative?
Well, I cannot answer it completely, but what I do know is it's important if you start a new treatment that all the other treatments or all the other physicians that you are visiting as a patient should be aware of the fact that you're starting a new treatment. So of course, I would always vote for having like a single hospital or a single GP treating you as a patient, because then it can be followed up and any interaction or side effects that might occur are just being monitored by your treating physician. So I would say that this would be the role of the pain physician, the pain specialist, finding the correct combination of treatments for your pain problem. Not necessarily a separate clinic that only does the medicinal cannabis treatment.
Yeah. And also a question I also had, where can we find more information about your studies?
So when we talk about publications, of course, there is like the scientific literature there where you can find our studies. As a research group, we have our own website. It's unfortunately only in Dutch. It's called samentegenpijn.nl. And I think via just regular channels, we will update any, of course, publication news that is available once it's there.
Okay. And we're running out of the half hour. It's already over. Just a final question for me, because you're not only doing your own research in the Leiden University Medical Center, you're also the board member in charge of research at the Dutch Institute of Medicinal Cannabis. What do you want to achieve in that function?
Yeah, so what we found out actually over the last couple of years is that a lot of research on medicinal cannabis is being done in the Netherlands, either on the plant itself or on a therapy kind of basis. So what I really want to do as a board member of the Institute of Medicinal Cannabis is really integrate all those researchers, so connect them to each other to see if we can share knowledge, if we can maybe find similarities in research interests that we have. So our idea is that we can create a network, at least in the Netherlands, but maybe also on a larger scale, to connect researchers and so that we can be of value to each other. So this is one of the big aims that we have as for the research in the Institute. Okay,
well, thank you very much. Thank you very much for your hard work. We'll we'll keep watching out for the research and really looking forward to the results. I can already tell the attendees that one of our next episodes, and we don't know the exact date yet, will be on new inhalation techniques to overcome, hopefully in future, these social side effects that come with inhalation. For now, Monique, thank you very, very much for your time. I hope everyone enjoyed this lunch webinar. We will subtitle it actually and put it on YouTube so you can watch it back later, or people that were not able to join us today can watch it back later. Monique, are there any final words you'd like to say before we close the webinar?
No, not yet. I would like to thank you for inviting me again and talk about this important topic. So I'm looking forward to more pain research in the future.